Dialectical behavior therapy is an evidence-based form of psychotherapy originally developed by psychologist Marsha Linehan in the 1980s to treat borderline personality disorder and chronic suicidal behavior. It evolved as an adaptation of cognitive behavioral therapy that integrates acceptance and change into one cohesive treatment model. There's this video of Marsha Linehan talking about how she developed this therapy system, and she basically explains that she was trying cognitive behavioral therapy with people with these particular goals in their therapy, but it ended up not working so well, and she developed this new way of doing things. Dialectical refers to the synthesis between acceptance and change, the idea that two seemingly opposing forces can both be true and need to be integrated. So you can think on one hand, acceptance is when you're satisfied with a situation, but then there's change. So how can you be accepting when a change comes along? Because you liked your situation already, and then a change comes. So that's the conflict between those two. Neuropsychologically, you can obviously think about that as some kind of positive emotional state that we feel in response to a situation, but we don't feel that same positive state in response to some other situation due to it being different. And the dialectical is supposed to help us navigate that. That's my understanding of it. DBT emphasizes validation of the client's experience while also supporting behavioral change. Validation is obviously necessary because, as the psychoanalytic schools with Sigmund Freud, you know, the guy with the cigar, as the psychoanalytic schools suggested, when we feel rejected, we are resistant. And instead of changing, we become even more certain in our original way of being. So the opposite approach is to, as Carl Rogers put it, be showing unconditional positive regard. Carl Rogers' famous quote is, "The curious paradox is only when I accept myself as I am, then I can change." That's the same idea. These next sections will explain how DBT differs from those approaches. Historical and theoretical foundations. Developed by Marsha Linehan in the 1970s to 1980s, after finding that traditional CBT alone was insufficient for people with severe emotional dysregulation and self-harm. Just to touch on the idea of emotional dysregulation, what that really means, because it's a very common term in psychology, but it's helpful to know the physical foundations of what is meant by severe emotional dysregulation in reality. And this is my conception of it, but I think it's the correct one. It's not the only way of thinking about this, though. Our brains, we all know, evolved from more primitive ancestors of ours, and the part of our brain that's responsible for keeping us safe is commonly called the reptilian brain, and it essentially is the part of the brain that triggers fight or flight responses. Emotional dysregulation, to me, means the same thing as those systems, those ancient systems, the fight-flight response associated with the sympathetic nervous system, which is the activating or fight-flight part of the nervous system. It narrows our perception to immediate threats, literally preparing us for a fight or to run, which is why we don't consider long-term consequences when we're in that state, which is also why it's called emotional dysregulation. You see, our emotions, although they are more short-term oriented than our frontal lobes, they're not completely short-sighted, because you can think, for example, about how you feel emotionally towards your family and stuff like that. It interacts with your prefrontal cortex to some extent. When you're calm especially, you think about your family and you think about yourself and you think about what that looks like in the future, and your emotions arise as a consequence of that, and you can think through it. And it's that interaction between the emotional systems and the prefrontal cortex that is considered emotional regulation, because you're deliberately attentive to what you're feeling and what that means and what you should do and all of that. Whereas when you're in fight or flight, all of that gets temporarily deprioritized in your brain, cognitively and neurologically, and everything around you becomes either a threat or an obstacle that you need to confront or avoid and run away from or defend yourself against. So that's kind of the way that I feel is necessary to look at the meaning of emotional dysregulation. The cause of that kind of mental state will become clearer as we go through the following points. The theoretical roots include cognitive behavioral therapy, which focuses on modifying maladaptive behavior and thought patterns. Maladaptive here meaning something like not beneficial in the long term or harmful to the individual or other people. Similar to in medicine, psychology has its own principles. In medicine, there's that very popular phrase that's apparently central to practice, which is first do no harm or something like that. In psychology, there's a number of principles that are outlined by the American Psychological Association, which is essentially the biggest organization in psychology. They set a lot of standards for everyone else. I'm going to flash their principles on the screen right here just so that I don't miss any. So those are kind of the lines along which our ideas of what's maladaptive have come about. It's because psychologists have to keep to those principles as mental health professionals. Another part of the theoretical roots of DBT is biosocial theory, which posits emotional vulnerability and invalidating environments contribute to disorder, which is absolutely the case. That's not even disputable, right? In a system, the way I think about it is, as people, we are essentially emotional, cognitive systems interacting with each other, and the way one psychosocial cognitive system interacts with another, there's like a transfer of emotions in that, partly because of the existence of mirror neurons in our brain. We can feel what other people feel, and so that causes some interaction merely by observing each other. And then on top of that, there's the fact that we have to actually interact with the outside world, which can affect us. All of that is very clearly the case. And there are certain cognitive and emotional skills that we might not have. There might be certain pieces of knowledge that we might not have, which makes us more likely to be emotionally vulnerable in an invalidating environment. If you're emotionally vulnerable in a validating environment, that can work fine. It's when we have these predispositions in an invalidating environment. Next part of the theoretical roots is dialectical philosophy. In this specific case, the integration of acceptance and change. Dialectical philosophy, obviously here, sounds related to Hegelian dialectics. I believe that's the correct philosophy, if I remember correctly, where essentially we have a thesis, which is some kind of idea, and an antithesis, which is a contradiction to the original idea. And what follows from thinking about those two ideas is a synthesis which takes the best of both into what's the new truth, or the new facts about the world, or the new way of looking at the world. And then finally, mindfulness from Eastern contemplative traditions incorporated into skills training. So that's taught as a skill. going back to what I was saying earlier about emotional dysregulation in the reptilian brain, mindfulness is specifically within a therapeutic context, within my understanding of mindfulness-based cognitive therapy. It's used to place a behavioral barrier between you and the version of you that's dysregulated, because there is a causal chain between calm you and the emotional dysregulation. And mindfulness is a block that you learn to reinforce, because part of what reinforces and triggers fight or flight is an increase in emotional negative affect. So if you put mindfulness in between, which is essentially attending to how your body is feeling, and thus, in a sense, validating your own feelings, right? Because some of the origins of the problem is an invalidating environment. So you're validating your own feelings by acknowledging them mindfully, attending to how you're feeling and what thoughts you're having, and understanding the source of it, and understanding that it's possible to allow yourself to be calm and all of that kind of stuff. That's a little hard to understand before you've tried it yourself. You put that in the way and you allow yourself to just, and that helps you return to a more regulated state. The breathing specifically is a very important part of it, although people have kind of had discussion about how essential the breathing is. The thing about breathing is it's part of your autonomic nervous system. And by taking intentional control of your breathing, you're essentially using your prefrontal cortex and some other parts of your brain to interrupt the autonomic system. I use the word interrupt. Really, it's you're taking control of your autonomic system, your prefrontal cortex, which is more intentional, it's slower, it's more deliberate. And when you're more deliberate about what you're doing, that's interrupting the original process, which would have taken you all the way to the fight-flight state, where you're hyper-aroused. And I mean aroused in the technical sense, like activated is another word for physiologically aroused. Activated, nervous, fearful, aggressive, defensive, all of that stuff. What DBT is and isn't. DBT is a structured program combining individual therapy, skills training, and real-life coaching, empirically supported. So it's supported by studies. It's not just a theoretical framework like psychoanalysis sort of was, although psychoanalysis did have some evidence behind it, and psychodynamic therapy, which developed out of psychoanalysis, is still commonly practiced today and shows efficacious results. DBT, like CBT, is very evidence-based. Empirically supported for reducing suicidal ideation, self-harm, and emotional instability, and for improving emotional coping skills. Again, using mindfulness and all sorts of other pattern recognition techniques and stuff like that. And the dialectic, which is a very important part. It's the idea of encouraging the idea that you can have a change happen and still be accepting of what's happening to you and that sort of thing. DBT is not simply talking about feelings. Definitely not. It's not one of those where you just talk. Although there's a lot of talking, the practitioner of DBT is there to help you recognize patterns and learn skills for emotional regulation, and they teach you a lot. And DBT is not discouraging emotion or pain, rather it teaches how to tolerate and work with intense feelings. Again, it's this idea of a dialectic between acceptance and change. You can feel all of these terrible things and you can feel all of that, but still be able to continue functioning and coping. Again, it's unpleasant and it's intense emotions, but the implication of that is not the behaviors that have been used thus far. It's these other behaviors that the DBT therapist kind of teaches, and it's helpful skills. It's not bad. Like, they teach good, helpful things as replacements for the old behaviors. Again, slightly similar to CBT, you can see how it's been influenced by cognitive behavioral therapy, CBT, because they, again, also teach changing behaviors and that sort of thing. But DBT has this difference to it where it's specifically focused on this dialectic of acceptance and change, and mindfulness is also, it's specifically in DBT, mindfulness and this dialectic. DBT structure and components. DBT typically has 4 main structural components. A, individual therapy. Weekly sessions where the therapist and client target life-threatening behaviors first and work through problems using DBT skills. Clients track behaviors and emotions using a diary card. B, skills training groups, like a class focusing on teaching specific DBT skills. Group sessions often run 1.5 to 2.5 hours per week. C, phone coaching. Clients can contact their therapist between sessions for help applying DBT skills in real time. And D, consultation team. Therapists meet weekly with peers to maintain fidelity to the DBT model and prevent burnout. You can kind of see a similar thing if you watch the show Couples Therapy, which I think is on, I can't remember the company that produces that show. I'll put it on screen. Although that's not a DBT therapist, that's a psychodynamic, psychoanalytic therapist. But similarly, you'll see them talking with a team, and they discuss with each other the sorts of things that they need to. The 4 core DBT skills modules. These are central to the skills training portion of DBT. 1. Mindfulness. Teaches being present without judgment, observing and describing experience, and participating fully in the moment. This without judgment aspect seems counterintuitive and difficult. For me, I simply think of it as not reinforcing a particular cognitive behavior, which is that negative appraisal, judgment. It's the same thing as negative appraisal in cognitive behavioral therapy. Why I think it's helpful to think of it as not reinforcing is because it gives you a practical, physical understanding of what's going on. You're reinforcing instead of thinking and judging, which is essentially the same thing as coming up with a whole stream of interpretations of what's going on. There's a way to observe without interpreting. It's something you only really understand until you've tried mindfulness and non-judgmental awareness yourself for a while. Once you understand practically how it feels, it makes a lot more sense. But if it feels unintuitive, it's easy to think of it as a skill that you're practicing. You're just reinforcing this, and it has downstream effects that are beneficial for mood and emotional regulation. In terms of practically what you're doing in mindfulness, I can only give a brief overview, which is this. You are aware of your internal experience and your external experience, which that practice alone engages the parts of your brain responsible for bodily awareness and awareness of your environment. If you want to know specifically what part of the brain, if I remember correctly, it's the somatosensory regions that are activated. The prefrontal cortex is responsible for thought and judgment and all of that. And it's supposed to be being used at specific times for specific reasons. And essentially, there's an overactive prefrontal cortex because of the way that the circumstances of the individual are set up. They don't get a chance to stop thinking. The prefrontal cortex is constantly calculating, and you're constantly in a state of worry and There's a lot more to it than that, and I'm making it, the way I'm saying this is creating a certain flavor that I'm not necessarily intending, but you get the idea. Mindfulness is an attempt to step between that and allow the people to observe without judgment, without that prefrontal cortex kicking in. 2, distress tolerance, skills for tolerating and surviving crises without resorting to harmful behaviors, includes radical acceptance and self-soothing. This is specific to DBT. You can imagine how helpful this would be, because it's our emotional states that are giving rise to the behaviors, and the strength of the behaviors, of the habits, which are the behaviors. And these skills, again, are intended to replace the old behaviors and habits with something that achieves the same outcome, but better, right? It's a better coping system. 3, emotion regulation, techniques to identify, understand, and reduce emotional vulnerability and to increase positive emotional experiences. Again, that's the mindfulness, but it's also other techniques that are specific to DBT. I'm going to flash some of those techniques on screen now so you can see what specifically they're talking about. 4, interpersonal effectiveness, strategies for assertive communication, building and maintaining relationships, and balancing one's own needs with respect for others. Again, this goes back to the biosocial theory. We're part of a network and a system, and it's that system that's part of what's causing the recurring dysregulation and behaviors, and social communication strategies and skills change the environment. So it's essential to be taught those, because you're stepping in and you're changing the environment so that the environment isn't constantly promoting dysregulation. How DBT works in practice. Personalized goals. Therapists and clients collaboratively set goals tied to, quote unquote, a life worth living. Of course, there are other therapeutic models in which the therapist sets most of the goals, and then there's the therapeutic models in which the client sets all of the goals. This is one of the therapeutic frameworks which have a mix. The therapists and clients collaboratively set goals. And then the second part here where it says tied to a life worth living. So this actually ties very much to existential psychotherapy, which isn't mentioned in the origins. That wasn't mentioned in the origins. But existential psychotherapy does touch on that kind of topic. The reason why it's used here is because of its motivational component. When it comes to motivation, there's a popular graphic and theory of approach versus avoidance, conceptualized originally by Kurt Lewis, who was a psychoanalytic psychologist back in Freud's time, who conceptualized this. He was actually quite a genius. He came up with a lot of very useful ideas for psychology. But you can see on screen, the idea is we feel motivated to approach things and motivated to avoid things, and there are different conflicts that arise out of that. So we can want to approach one thing, but want to approach a different thing simultaneously, and that's called an approach conflict. Then we can want to approach something, but there's something about that thing that we want to avoid. That's an approach-avoid conflict, and you can imagine all the different configurations of that. This idea of a life worth living, it's tied to the idea of intrinsic motivation and extrinsic motivation. I think we all understand this to some extent, so I'm not going to focus on it much more than that. Next, skills are practiced repeatedly and reinforced with homework. Real-world application is emphasized, for example, phone coaching and diary cards. Finally, treatment can last at least 6 months, and often longer because skill acquisition and habit formation take time. I'm sure we've all heard the common knowledge idea that it takes 1 to 2 months or 2 to 3 months to form a new habit. That's essentially why that's the time duration chosen. Although the skills themselves, obviously, I'm sure you can imagine a time in your life where there was a skill that you wanted to learn, or there was a skill that you were taught and it stuck in your head and you stuck to it on your own. But of course, it's much more effective if you have a coach or a therapist to help you work through it. And that's why they chose this time span, because to get real, strong, positive results, the longer you spend doing it, the better. The longer you spend practicing, the better you are at repeating those behaviors. 7, clinical applications and who it helps. Originally developed for borderline personality disorder. I'm going to flash on screen what borderline personality disorder is, because that's not what this video is about. DBT is now used successfully for self-harm and suicidal behaviors, eating disorders, PTSD, and trauma-related conditions. Again, all of this is evidence-based. Mood disorders, e.g. depression, bipolar, substance use disorders, emotional dysregulation across populations. 8, evidence base. What research shows. Early randomized controlled trials, the gold standard, showed significant reductions in suicide attempts, hospital stays, and severe symptoms compared with standard treatment. Replicated research found sustained improvements in emotional regulation and reduced emergency care utilization. DBT is widely accepted as a mainstay psychotherapy for complex emotional disorders. In everyday life, examples of DBT skills are mindfulness exercises, observing the breath to calm an emotional surge, distress tolerance techniques like STOP, S-T-O-P, which stands for stop, take a step back, observe, proceed. Again, it's a practice, and once it's reinforced, it can help you easily get in the way of an emotional cascade situation where you're increasing in your destabilized emotions, and then you enter fight or flight. And once fight or flight happens, it's a lot like throwing a stone. It's very hard to stop it once you've let it go. So the skills are intended to stop you getting to that point to begin with. Another DBT skill in everyday life is emotion regulation, which is identifying emotions and creating opportunities for positive experiences. So that's, again, the kind of awareness of oneself, pattern recognition, and behavioral reinforcement to replace old behaviors and old emotional dysregulation patterns and stuff like that. Finally, another DBT skill in everyday life is interpersonal effectiveness, using Dear Man to ask for needs assertively. On screen you can see what the Dear Man thing is. 10, misconceptions and questions to address. DBT is only for people with bipolar disorder. That's false. As you can kind of hear from all the things I'm explaining, anybody can use these skills. The part of it that's specifically aimed towards bipolar disorder originally was the dialectic part of it, which is the distress tolerance part of it. The thing is, bipolar disorder and everyday, life that everyone experiences, not just those who have such diagnosis, there's some overlap, which is why these skills and therapeutic methods are so helpful for everyone else also. It's only about changing behavior. DBT also focuses on acceptance and validation alongside change. Going back to what I mentioned earlier about the idea that once we accept ourselves, then we can change. It's a natural instinct for us to defend our identities as social animals we have needs that we are trying to meet. That's where everything within us essentially comes from. It's this meeting our needs, our physiological needs, our social needs. Invalidation of that comes from outside to regulate us because others perceive us attempting to meet our needs as conflicting with their meeting of their needs, which is not necessarily the case. It's just that they perceive it that way because they don't know how to cope with meeting their needs and us meeting our needs, especially when we're young. People don't interact with children always successfully. Certain skills need to be taught to do that effectively, and that's kind of where that originates. But in general, not just with children, when people meet with seemingly conflicting needs and they don't listen actively and they don't have those kind of communication skills to help resolve the issue peacefully, invalidation is the usual approach. It can come from either side, and then it creates a resistance within us, and that resistance creates frustration. It's a frustration that's caused. Invalidation causes frustration because when we need to fulfill a need, invalidation means no, you're not going to get to fulfill that need, but it's a need, right? So we're biologically predisposed to be frustrated with that, and that frustration is what causes a lot of fight-flight response, and that it's that fight-flight response that causes some effects downstream when we don't have the skills we need. And so that's why validation is also part of it, because it's that invalidation and the frustration caused by that that's upstream that can lead to the problems. If we never had that invalidation to begin with, we might not have had the problem at all. We might have just, because we would have already felt like we can get our needs met, and then perhaps we learn the skills that we need to, and everything's handled peacefully and things work out. But it doesn't always end up that way. We end up invalidated and frustrated, and without the skills we need to handle that invalidation and frustration effectively, and then that's where the challenges can arise from. 11 practical tips. DBT is most effective with trained therapists, but self-help resources can introduce skills. This is what I was saying earlier. I'm sure you watching this can recall a time in your life where someone taught you something and it just stuck, and you tried it and it worked and you got better at it, and you didn't need to stay being taught by that person constantly. You just learned the skill. Like personally, once I learned how to fold a paperclip into a phone stand, I didn't forget it. I could do it right now. I probably forgot a little bit how to do it, but you get my point. There are some skills that you can just learn, like it clicks for you, and you can start with those. Not all the skills are like that though. Like I just said, no, it's most effective with trained therapists who know all of the stuff that I'm rambling about. And trained therapists have a keen eye for this sort of thing typically, so they can spot what's a diagnosis and what's not a diagnosis, and what skill is most effective versus what will only be a little less effective, or it'll be temporarily effective. Because if they don't know that stuff, they don't get their licenses from the boards. They get taken off of their work because they haven't kept up to date with their training. If they don't know this stuff and they don't know how to help the clients, they're violating those original principles that I mentioned at the beginning of the video, and they're not allowed to practice. If they don't know this stuff and they're practicing, it's because they've gotten away with something that they shouldn't have. It's also important to know the value of consistency and practice over perfection. Perfection is the enemy of progress. Famous saying. You just need to keep in mind the nature of our brains, sort of. The Hobbesian law of Donald Hebb is what fires together wires together. It's a matter of training and strengthening. What you practice, you get better at. So the DBT specialist offers the things that if you got good at them would help out a lot. And you can start very small. Atomic Habits, I think everybody's heard of it. You start small, and as small as possible, you start with what you'd really be willing to do. If you're being completely honest with yourself, if there's something you want to try out, you start with the smallest step that you will do. If you're trying to exercise, do one curl up, and that's all. And then tomorrow do one curl up again, and just experience it. Feel what's going on inside. Feel how it feels, so you get comfortable with it. And once you're comfortable with your starting position, that's when you can continue going forward. Again, it's when I accept myself that I can change. Memorize that quote. Just to show you, to end this video off, why clinicians trust DBT, here's a screenshot of the evidence regarding its efficaciousness. Big numbers. It's one of the most effective therapeutic practices next to cognitive behavioral therapy. If you want to see the top 10, here they are. DBT is right there. Now, obviously, comparing them in a top 10 is a bit weird because they have different purposes. So if you're comparing apples with oranges, that doesn't really help, but it does give you some idea of how tested it is. Hopefully this video was useful for you. Leave a like, comment, subscribe. Thank you for watching. Bye bye.